Hello, my name is Tynisha PowerPoint. I am a CNA instructor student that is presenting today for a sepsis prevention infection and hand hygiene, how to properly wash your hands. Did you know hand hygiene is considered the most effective method to prevent the spread of infections? Why? It reduces the transmission of germs from person to person by removing harmful bacteria from the hands. It plays a crucial role in infection control across healthcare systems and public practices, and proper hand washing with soap and water and or alcohol-based hand sanitizer solution can significantly decrease the risk of acquiring infections. Washing hands can help keep you healthy and prevent the spread of respiratory and diarrheal infections. Germs can spread from person to person, either from surfaces, or when people are touching, kissing, hugging objects, things like blowing your nose. All of those are ways to spread infection. What can we do to keep ourselves healthy and safe, or what can you do to help yourself and loved ones stay healthy? Washing your hands often, especially during times when they are likely to spread germs. So, when are those times? Some of those key times to wash your hands are before, during, and after prepping food, before or after eating food, when caring for a loved one who is sick, whether it's with a GI distress with nausea, vomiting, diarrhea, or coughing, the upper respiratory viruses blowing their nose, and before and after treating an open wound. These are all ways that infections can invade our body. And so it is recommended to kind of keep those in mind as key times to wash your hands. The step by step guide to proper hand washing will include the following. So it is recommended to wet your hands. So you're going to turn on the water and you're going to wet your hands, and you wet them thoroughly, and then you apply some soap and wash your hands. And I'm just doing a dry demonstration at this time because later in the video I will provide a step by step hand washing activity. But you're going to apply the soap, making sure that it can be liquid soap, a bar soap, and or foam soap. But you're going to lather your hands up really good, making sure that you get in between each crack and in between the fingers, in between the thumb, making sure you scrub your nails to make sure that you're being able to clean under your nail beds and washing them. And it is recommended to for a minimum of 20 seconds, a minimum of 20 seconds to wash your hands. What I would suggest, as the CDC will recommend, is that singing the ABC song as you're washing your hands. Although it seems like something that's very minute, just stand there and do a 20-second count. It can be lengthy and uncomfortable, so it's recommended to say the ABC song as you are performing your hand hygiene. The CDC recommendations also recommends that hand hygiene also includes hand sanitizer, and it should be a minimum of a 60% alcohol-based solution. Hand sanitizer can be used when soap is not readily available or in all situations. So you can use the hand sanitizer if you do not choose to use the soap and water. However, hand sanitizer is not recommended for visibly soiled hands that are contaminated with fecal matter. That is the one disclosure that the CDC is recommending, that if you have a visible stool or fecal matter on your hand, it is not recommended to use a hand sanitizer and to do a full soap and water cleanse. Hello, this is Tynisha PowerPoint, CNA instructor student. I am going to perform a hand hygiene activity on the proper hand washing hygiene. And so to get started, the different steps that we will take is that we want to turn the water on. And we want to make sure that it's the water, the temperature is at your leisure, your liking. And we're going to wet the hands. And as we wet the hands, and then we go to get our soap. As we get our soap, we're going to lather up, do a great lather. And then we'll count to 20 to make sure that we're washing the appropriate area. So we're going to count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. And then we're going to rinse the water, rinse the lather off of our hands with the water that we chose. And then before we turn that water off, we're going to grab our paper towel and we're going to dry our hands. And we're going to dry our hands with the paper towel in a dabbing manner. And then we are going to turn the water off and discard of our tissue in the appropriate area. This is how you perform a hand hygiene hand washing technique. Thank you.